New year, new resolutions, and a new season of To Your Health, and a new co-host to To Your Health, Dr. Victoria Uribe. Victoria, welcome.
Thank you.
I want to know first, before we get into all of the medical issues, I want to know a little bit about Dr. Victoria Uribe. Tell us a little bit about who you are and where you're from and why you went into the medical field.
Thank you for having me. I'm a pediatrician at the Elmhurst Clinic. I've been there for 14 years. I'm originally from Montana, small town by Billings, Montana. From there I went to college in California. So I went to study chemistry at the University of California at Irvine, and then went to Stanford University for medical school, where I met my husband, who was there getting a master's in engineering, and I followed him to the Midwest because he told me Chicago was the best place to be.
And he's absolutely right.
And I've been here 25 years now. So I did my pediatric training at Children's Memorial Hospital, which is part of Northwestern. It's now called Lurie Children's Hospital. And then I worked in an inner city clinic, Erie Family Health Center, in Chicago for 7 years, which was mostly Hispanic patients. Got my Spanish much more fluent. And then from there I moved to Elmhurst Clinic just because I lived in Elmhurst and it was a much closer commute for me. So I've been there for 14 years. I work at the Elmhurst Clinic in Elmhurst, right next to the new hospital, and also work half days at the Addison Health Center, which is down the street.
So you're right here, right down the street, the right. Elmhurst Addison Center for Health also, as well as the Elmhurst Clinic that is adjacent to the hospital, correct?
Correct.
You also do a lot of volunteer work.
Right. I've always tried to do extra things just to give back to the community. So when I started working at Elmhurst, I started working also at a clinic in LaGrange, which was underserved for the poor clinic, and I worked there for 10 years. On my days off, would work over there. And then I stopped that after about 10 years, and then a year and a half ago I started working with a group called Healing the Children, and it's an organization that does work in other countries trying to help children who need more health care. So part of the program is they bring some patients up to this area who have heart problems, and they get heart surgery done pro bono here in the area. And then we also go down and do medical mission trips in other countries. So I've been going to Nicaragua 3 trips so far, and go to do medical work down there. We take surgeons down to do surgeries on kids and
so special.
Take care of patients and have a good time. So it's good giving back to the community over there, things that they don't have access to a lot of times just because of financial reasons. And we perform surgeries for free. I don't do the surgeries, I take care of them before and after.
Before and after.
Right, right.
Do you ever bring your children into your volunteerism?
They haven't gone out of the country with me for these trips, but when I was working at my volunteer clinic in LaGrange, they would go with me and just help in the office sometimes. They would help make blankets. We make fleece blankets, would take to the kids there. And we also make a lot of fleece blankets that we take to Elmhurst Hospital in the pediatric unit where kids are admitted for illnesses or surgeries. Each patient gets a blanket when they get admitted. So different organizations help out with that. So I get my kids to do that with me and try and help out other kids.
It gets them to understand what you do also. Now you have 2 daughters.
Right, 2 daughters, right. The oldest is a sophomore at University of Wisconsin in Madison. She's studying mechanical engineering. And my second daughter is a junior at York High School and just starting the college pursuit.
So from Montana, you've become a very local person. You're right here, very hands-on with the family here along with you. We want to talk a little bit about something that, I mean, this is this flu season. This is the cold and flu season, and that's all we hear about. Oh, the flu, you have to get the flu shot, you know. What's the difference between a cold and a flu?
Very confusing for a lot of patients. They don't know what the difference is, and even for us, we don't always know which it is. But one misconception is people hear a lot about stomach flu, and there is no stomach flu.
There is no such thing as stomach flu?
No. So flu in general is more respiratory problems. When you have a lot of vomiting, diarrhea, that tends to be more other viruses. So when we do the flu vaccine is to prevent the respiratory problems. So colds, just regular common cold, usually starts pretty mild. You get a little bit of runny nose, maybe a little bit of coughing, sore throat, headaches. Some fever sometimes, but usually aren't too sick, and usually goes away within a week to 10 days. Flu tends to come on much more suddenly, so you kind of get sick really severely the first couple of days. Also cough, congestion, headaches, tend to get higher fevers, so maybe 103, 104 fevers, much more achiness, like your body aches a lot, your back, your muscles are really achy, just look a lot sicker, and more likely to get complications like pneumonias and things like that. So much more severe illness.
And is it as contagious as people think it is? I mean, everybody says, oh, it's contagious, stay away, And is it contagious when you have it or before, or are these all myths?
It's probably contagious slightly maybe the day before you actually get symptoms, and while you are sick, you're definitely contagious. And it's like any virus, respiratory virus, contagious from coughing on somebody. If you cough in your hand, you touch something, you can kind of pick it up that way, but definitely pretty catchy. And most of the kids that we see, the parents are sick also. It's kind of hard to keep it from passing around.
Well, you just share it with the family.
That's right, share everything, right?
It's not something that you really want to share with them, but it does happen. There are different strains of the flu, and there's the flu shot. Is the flu shot, does that mean you're not going to get the flu at all? And do you get symptoms from the flu shot?
So the flu shot is not 100% guarantee you won't get the flu, but it's the best thing we have to prevent it. So the more people we vaccinate against it, the fewer kids or patients will have with flu. It used to be protected against 3 different strains of flu. The newer version now this year is against 4 strains, which is better. So it covers more. Right. So it covers 2 type A strains and 2 type B strains. You don't get the flu from the vaccine. A lot of people think they do because they get the vaccine. The next couple of days they get a cough or a cold. They probably were going to get just a regular cold virus, nothing to do with the vaccine. So you don't get sick from the vaccine.
So the vaccine is actually not a strain of the flu that they're vaccinating into you?
It is, but it's manipulated, so it will not make you sick. Right, so, and it's a dead thing, so it's very safe to give.
And why is it this weather specifically? I mean, really, you're fine when the weather is nice.
Right.
And then as soon as it gets a little damp and a little cold, and we have a lot of that, from a long season of that here, does the weather really affect?
Somewhat. Certain viruses you definitely see more seasonally. We think of viruses much more in the wintertime in Nicaragua, which is summer weather the whole year round. They still have sickness no matter what year round, right? So it's not the cold per se, but definitely certain viruses are more common certain times of the year. So flu tends to be more common in the winter months. Partly just that's when it's more around this area, and then also we're inside more, and so it's easy to pass on to people more versus being outside, windows open, less exposure to people.
Didn't think about that. Yeah, you're inside quite a bit in the colder weather,
right.
And then they tell you dress warm, don't dress too warm. There's
right.
pros and cons to all of that.
Right. The other thing people sometimes think is like going out in the cold weather is going to make you sick. Going out with wet hair, we all raised with that myth.
Oh yeah.
And you actually do get the infections from people. So it's people with you who pass the infection, not the cold weather.
So it has nothing to do with going out with wet hair.
Nothing.
It has nothing to do with your coat isn't warm enough.
No, nothing to do with it. Right.
Or your child is overbundled and sweating and you're going to get sick from that.
Right, they will not. Right, it's more from people passing things on.
And while we're on kind of that topic, what about all the old remedies that we always used to talk about? A cup of chicken soup, fruit juices, this is what you should be taking.
Yeah, definitely things, as far as, well, first of all, preventing the flu in the first place, besides the vaccine, good health helps. So if you get enough rest at night, if you eat healthy, which includes, fruits, vitamin C, you drinking plenty of fluids, washing your hands, things like that are really good ways to prevent the flu. Once you're sick with either the cold or the flu, it's also trying to help make you feel better. So chicken soup makes you feel better, totally fine to do. Yeah, vitamin C definitely helps you fight off things a little bit more, so that's completely fine to do. Lots of hydration, lots of rest, just pain medicines, ibuprofen or Tylenol just to help you, with the aches and pains is totally fine. There are other treatments for flu, antiviral medicines that you can give that are prescription medicines. Most important is for people who are more risk, so people who might have asthma or heart disease that could get really sick from the flu. Definitely want to treat them with the antiviral medicines. Most healthy kids or young healthy adults don't necessarily need the medicine. It does help shorten the duration of it, but there's also side effects. So if you don't need to use it, right, like anything, exactly. So most of it's supportive care. Is trying to just make you feel more comfortable, get plenty of rest, and just get over it. So.
And plenty of rest. You keep saying the plenty of rest, and but what about just eating properly?
Definitely helps a lot, right? But I think people who in general don't sleep enough at night, teenagers especially, we have that. If you're not getting enough sleep, your immune system just can't fight things as well.
So it's more the sleep than what you're eating.
Right. Well, partly it's both. I think it's both. But if you don't sleep enough, I think you're just more prone to getting sick. So sleep is good. And
now you obviously see a lot of patients that have colds and flus at this time of year.
Right.
But I was very amazed at the numbers of deaths every year.
Right.
Because of flu. It's not just the flu.
Right, exactly. You do get very sick and miserable, the regular type of flu, but a lot of complications. So in this country alone, over 200,000 people a year are hospitalized with flu complications. At least 20,000 people die every year of flu.
Of flu, and this is what I didn't realize that until I was starting to read a little bit about it before the show.
Right, and people that tend to get sicker from it tend to be certain people at certain higher risks. So young children tend to get a little sicker, older population, so over 65. Pregnant women have much more complications from flu. If you have underlying illnesses like undergoing cancer treatments, heart disease, asthma, diabetes, things like that, you're much higher risk also.
Now, you're the pediatrician. Again, is it a myth or is it fact? Children under a certain age, newborns, are immune.
Newborns do have some protection just because of the pregnancy. Mom passes on antibodies to them, so they do have the first several months some protection. But they also, still under 6 months, they can't get the flu vaccine, and so they are at more risk also. So it's still good to prevent by protecting people around them. So having the parents vaccinated, any siblings, grandparents, that will help protect that young baby.
Now, the flu vaccine isn't always in the form of a shot.
Correct. There's a newer form. It's been around for quite a few years now, but there's a nasal spray that you can do also. Very nice for people who don't like shots, adults included. It's approved for ages 2 years through 49 years old, so not the real young or the older populations, but very safe, very easy, and just as effective as the shot. Certain people can't get the nasal spray because it is a live type of vaccine. So anybody with asthma, we tend to not use it for them. Pregnant women, we don't give it. And people who might have other underlying illnesses, we don't use it so much, or egg allergies also. But anybody else who's generally healthy can get.
Egg allergy.
Right. The shot you can give, typically if you have an egg allergy, for most people, the vaccines are made with egg embryo, and so that's why certain people react to it.
So you should see your doctor.
Right, and they can help you decide if it's safe to give or not. But.
Well, and that's why I've always enjoyed having a local doctor, a doctor that knew me. Now, you were a general practitioner.
Correct.
Before you chose pediatrics as your specialty.
Actually, when you do your residency training, you do it in whatever specialty you're going to do. So it's primary care what we do, but it's just pediatrics. So I do take care of newborns through high school.
But because you're a general practitioner, you can see them on into older ages, into their college years or up to the college?
We usually do through high school because once they turn 18, 19, they're more adults and have more adult issues, and so I send those on to the adult doctors at that point. So.
But I thought in our conversation before the show, I thought it was interesting that now you're starting to see those children that you had as patients when they were young, bringing their children in.
Right, so they get very attached to us and they like to come to us as long as possible. But once they become adults, get married, have kids, I do have some of them come back and bring their own kids back to me, which is nice.
Well, and that's kind of a comfort zone because you know the family, you know the person from the beginning, from when they were infants.
Right.
So it's easier for you to talk with them. It's also easier for them to talk with you.
Right. Definitely you build a good rapport when you have a primary care physician to see. You know, you get to know each other, and it's easier to teach them, for patients to trust you with the advice that you're giving. And it's just nice to get to know people as they're getting older and seeing kids growing up. Yeah. So I think it's a win-win situation.
It's a good comfort zone.
Right.
And I think that's important, because sometimes I think that's more than 50% of the cure is being comfortable with how you're being administered medication to, or whatever. It's a comfort zone.
Right. And a lot of what we see is, I mean, with these colds and flus, it's viral. These are all viruses. There's no antibiotics for it. There's no big treatment for it. It's a lot of it's educating and supportive care.
And another thing that you said that kind of I was surprised at, I always thought colds lasted maybe 3 days. Mm-hmm. They last longer.
They can last longer, right. So colds can be typically up to 7 to 10 days. So flu, probably about the same time, but it's just much more severe. You're just much more miserable from it. So the other thing just to let people know is just when it is important to see your doctor, or when it's good to call. And I think, if the illness is going longer, 10 days or more with cough ongoing, it's good to call your doctor. If you have ongoing high fevers, 103s, 104s, not improving, probably a good idea just to check things out, especially to make sure there's no complications like pneumonia, ear infections, things like that.
And sometimes pneumonia, you don't really even know that you've progressed into pneumonia.
Right. Right. You often don't know until you come in to get seen. Sometimes need a chest X-ray, or just with exam we can diagnose that.
And there's what they call walking pneumonia. I really don't know what that is, but that's something that can be very dangerous.
Right, and it depends. Some people do get scared of the word pneumonia, and it's sometimes not so severe. I mean, sometimes we can just give antibiotics at home and people are fine. Some patients do get a lot sicker and need to be in the hospital to get IV medicines and get oxygen at sometimes.
So what we want to do is we want to encourage people to eat well, sleep well, hydrate a lot, mm-hmm. Hence right. the water, wash your hands.
Right, very important.
Very important to keep your hands washed. How do you manage to do that in the hospital all the time, and people are coughing and sneezing, and it's difficult?
It is, yeah. I get my flu vaccine every year. I wash my hands a lot. We wash our hands before and after every single patient. Yeah, I have a pretty decent immune system, which does help. I think being exposed to all this for 20 plus years.
You've built it up.
Do pretty well trying to stay healthy. But I do eat healthy. I try to get enough rest, unless I'm on call.
Well, and that's very important, though. Mm-hmm. And I know we always say teenagers sleep a lot. Not really.
Not enough, right? Most teenagers, when I ask every patient how much they sleep at night, and most teenagers typically about 6 hours.
Really?
Yeah, recommendations 8 or 9. So they're usually pretty deficient on sleep.
Yet if it's the weekend and it's Saturday and they're supposed to be helping you clean their room or something, they'll sleep until 1 or 2 o'clock in the afternoon.
Easily.
I don't know if that's intentional or, just catching up. But there is no catching up on sleep, actually.
Not really. They really say each night should be a good amount of sleep if possible.
It's a separate, it's a whole separate thing. Now, we need to know how people can contact you. Mm-hmm. In particular, your office. Do you want to give us your office numbers and how they can reach you?
So I'm at Elmhurst Clinic. There's actually 10 pediatricians and 1 nurse practitioner in our group. We also have internist family practice in our Elmhurst Clinic and other specialties. So for the pediatrics, it's 331-221-9002. Also, you can look online under Elmhurst Clinic and learn more about our office and about Edwards Elmhurst Hospital.
Well, and I will say one thing in closing. Edward Elmhurst Hospital, their message is healthy driven, which I totally respect, because you have to sit in the driver's seat and you have to be in control of your own health. You have to be your own health advocate. No one can tell you how you feel. Mm-hmm. You know how you feel. So that healthy driven, you have to be driven toward good health. And
right. I think years ago, I think people were more reacting, like once they got sick, they went to the doctor, and I think we're really trying to get people healthy ahead of time to keep them from getting sick.
Preventative is the best.
Preventative is good medicine, yeah. That's a lot of what we do in our practice.
So use the Edward Elmhurst message and healthy driven and drive toward preventative and permanently good health.
That's right.
Okay. Dr. Uribe, we look forward to you next month. We hope you will continue to watch on Addison Community Television. Dr. Uribe will be our co-host, and thank you very much. We'll see you in February.
Thank you for having me.
Thank you for joining me. I'm Lucille Zucchero.
I'm Victoria Uribe.
And here's to your health.